Welcome to the Ultrahabits Podcast. Good morning from cold Melbourne, Australia. How are you going?
I'm very well, thank you, and good afternoon from springtime in Baltimore.
Yeah, look, I really appreciate you connecting on the show. Today we're going to be talking about addiction and everything that goes with that. And I think it's an important topic, and you would appreciate more so than anyone. I think everyone in the world has been touched by addiction. Like, we all know someone that has suffered, and a lot of the times we've, been part of that process is either people that are addicted ourselves or relatives or friends. And it's a pretty full on situation. So today I want to unpack a little bit more about addiction. But before we go into that, can you just give the audience a flavor as to your journey as to how you got into this work?
Yeah, absolutely. Well, clearly I work as an addiction psychiatrist. That's been an interesting path there for me. So, just in terms of my life story, I've been in Baltimore, born and raised, love it, and I live very close to where I grew up, close to my parents who live still about a mile away. Two brothers. I had a great time in school and everything like that. We did start drinking when we were pretty young. It was very normalized in a sense of, weekends through high school, we drank, and, I did enjoy drinking whenever I could. And then a little bit more experimentation, with marijuana and some psychedelics and stuff in college. Again, very normative. And then I went to medical school and the first 2 years were very much like college. Yeah, again, I hung out with people who tended to drink a lot. So again, it seemed very, very normal. I did just fine in medical school. And when I had the second 2 years of medical school where it was a lot of like work, the rotations, so you're in the hospital. And then I did my residency in anesthesiology. It looked at a lot, so there wasn't too much REA going on. I was drinking by myself when I could, but it wasn't a huge volume. I think the problem really arose for me when I got into fellowship and I didn't have overnight call anymore. And I started to feel like, hey, sort of almost where I want to be with regard to finishing the training, and having drinks at night was a very routine thing, very normal thing. So I did that. And then as the drinking sort of progressed slowly, I started to have sleeping problems. We ended up having kids. So I got 3 kids and married my wife, who's wonderful. I guess, I was at a place where working pretty hard, drinking when I come home at night, and now it's a bit of a change when you have 3 little kids. There's a lot of work associated with it. All really, really good stuff. But you put drinking on top of that, it makes it more unmanageable. So drank more and more. And then I realized that I could, if I mix other things, sleeping pills, and then ultimately opioids into that, I cut back on the drinking. But I developed an addiction to opioids very quickly. To taking pain pills. This was like, kind of the 08, 09 period. And before I knew it, I was taking pills all day, every day, to avoid withdrawal. And it was interesting because I didn't really learn much about addiction in medical school. I learned very little, even in pain medicine, which I was practicing. I didn't know anything about it. I didn't know about recovery. I didn't know what services were available for treatment or anything. And so it was kind of news to me when someone said, "Oh, you have an addiction." And I ended up in my first treatment program in 2009. I went there and went for 3 months. The actual experience was good. When I came home, I felt a lot of shame associated with it. I was no longer working, doing pain management, which I was doing. And I came up to this wonderful place called Ashley Addiction Treatment. And I started to work as a staff physician. I worked here for a little bit to fill in for somebody, and then came up here to work full time. And but I relapsed. I wasn't able to stay sober. One thing I did that was really good is I started to go to Alcoholics Anonymous, develop a network, feel connected to that crew. But in my life, there was still a lot of shame around it. I felt pretty rotten, so I wasn't feeling great in my recovery. So I might end up going back to treatment in 2011. And I went down to a place in Atlanta, which is wonderful. Stayed there for 4 months. Got back home, and at this point I was really ready. But I'd also had a lot of consequences. I had the board of physicians suspended my license, so I didn't have an ability to practice for 2 years. I didn't know if I was ever going to have an ability to practice again. I knew it wouldn't be a good idea for me to go back into anesthesiology or pain medicine, where there's greater access and early recovery. It's very, very risky. So I sort of had to reinvent myself and figure out what I was going to do. I had a huge advantage that I was able to take the better part of that whole year to ground myself in recovery and to really take some deep roots and establish, that pattern for living, which is so very different. The pattern of living and thinking that is so much more productive and better. And I ended up going back to school in the second year of my suspension and got a master's of public health, and then went back and did a psychiatry residency. And so thankful for all the people who helped me, stuck their necks out to get me, into the program. And then I finished in 2016. And after that, I was invited actually to come back to Ashley, where I currently work now. And I started out as an addiction psychiatrist. We're still functioning that way here, in addition to some administrative duties that I have. So it's been an interesting journey, but I'll tell you, the last almost 13 years have been kind of about the best of my life. It's been great to be in recovery because it makes that so much easier.
What a remarkable journey, Greg. I have so many questions. I guess the first question is, when you were studying medicine, particularly when you got involved in anesthesiology and you're dealing with some hardcore drugs, and are you saying there was no actual training around the potential for addiction?
I would say at orientation, we watched a video about an anesthesiology resident who had become addicted to, I forget what medications, whatever, it was probably a mix of opioids and sedatives or whatever it was. And he ended up dying in the video, and relapsed and died. And then at the end of that, I had one of my colleagues stand up, and she said her brother passed away a year before. He was a resident in anesthesiology too, and he died in the call room. So it wasn't that there wasn't awareness. And then our program director said, hey, this stuff occurs. Be aware of it. Don't do it. So he was known to be a risk. There's no question, and that was told to us very clearly. But the concepts of understanding what addiction is, for, the understanding of, the health that was out, it's potentially out there. Didn't know anything about that. So I really didn't have the ability to be aware of what to look for. So the writing was on the wall in my case. There's no question, that things were occurring, but I just didn't know how to recognize it. And also there's just a ton of denial, and most it's denial issue, denial, rationalization, minimization, those kind of things. And they're doing better now with regard to education, for sure.
In terms of what I've seen with addiction, particularly when I go back to the US, when I was coming up, we were hit with a meth epidemic probably in the mid 90s and late 90s. When I go back to the rehabs in California, I'm seeing an increasing amount of use in things around like fentanyl and drugs like that, which seem to have such a higher mortality rate. How has the landscape shifted in terms of the drugs that you're seeing and just the nature of how addiction's playing out at a macro level?
The landscape has changed quite a bit, in particular with regard to the introduction of fentanyl. And the reason that fentanyl is so important is because it's a highly potent opioid that will cause overdose death, due to respiratory depression much easier. And now what's happened, because you have this something that is much lower volume, it's easier to transport. It's going to be easier to utilize for those who are manufacturing it, transporting it, and selling it. So now we see a proliferation of fentanyl, and rarely do we see even heroin anymore. People think they're taking heroin. People think they're taking oxycodone, and that it ends up mostly being fentanyl these days, just because of the availability of it. But we Yeah, I mean, the opioid, there's a long story with regard to what's happened with opioids. There's a good story about what's happening with stimulants. So talking about, cocaine, crack cocaine, methamphetamine, and there's a lot to it. And it has to do with drug routes. It has to do with regional areas. In some places, take a place like Baltimore, it's very much traditionally heroin and crack. We don't see much methamphetamine. A lot of that's because that's what the dealers are used to. And so they're kind of keeping the methamphetamine out. We're also seeing the introduction of a lot of new drugs, which are very scary, and drugs that are sold with a dark web and that has, names that are letters, and they're opioid-like or they're sedative-like, and you don't really know what you're getting. You don't really know what you're taking. You have no idea what the dose might be. So it's a pretty scary place to be. New drug around here called Trank, which is, it's nasty. It causes horrible skin sores and wounds associated with it. So we're seeing things absolutely get worse. And then when you add in something like COVID, where you see people with additional just challenges in life and larger mental health challenges, just with depression, anxiety, those kind of things, people tend to use them up. So we're drinking is increased, So across the board, we're seeing people struggle with substances.
That's an interesting point. Like, how does societal and cultural factors actually influence addiction and, in treatment in general?
I mean, that's a big question, but massively is the answer. Let's just take, one example. I mean, if you look at cannabis, right now, and you say, okay, well, let's look at the history of cannabis. First of all, let's look at the psychoactive substance, and there's THC. So you take a plant and you use that plant typically for smoking at, the low concentration of THC. And historically that had become sort of villainized, at some point. This is a horrible thing. You hear about reefer madness and all this. And there's an overblown, sense of danger associated with it. And then you're seeing now, the exact reverse of that, where, first trying to medicalize it, which we haven't done yet. There are a couple of cannabinoids that are used, FDA approved, we could prescribe them and stuff, but marijuana itself, in all of the way that it's, medical marijuana has been, is not the way we see typical medicine. And then you legalize it, which comes with, the fear of it, or the incorrect assumption that it is safe, and it's not. So, we've done almost a 180 with regard to how we view marijuana, and the reality is in the middle, right? There are, things that we all should know about a substance before we put it in our bodies and make decisions according to fact, not according to, the often incorrect information that's out there. So it's very hard to get that information, but society plays a huge role. And you look at, we can go through this for a variety of substances and give the reasons of why it's been able to, create prohibited and stuff over time. Why alcohol's the outlier on that one. And even the way that people with substance use disorders are viewed has changed and flip-flopped. At one point they're patients and sick and need care, and then they become morally depraved, criminals, and now we're starting to see them again as, people sick with a disease. So society has, so much to do.
In the addiction recovery community, the view of that community on legalization of drugs, like, what's your view? Like, does legalization help remove the stigma, or does it just make it a free-for-all? And I'm supposed that there might be a gray area in there, but what's your opinion on that?
So with regard to stigma, not necessarily, because alcohol has been illegal, and hadn't been prohibited in essentially any of our lives, yet there's been a large stigma associated with alcoholism or alcoholics, and that problem. I think we're absolutely making good progress there, but it doesn't necessarily have to do with the legalization of a substance. I think that over time we have been absolutely too punitive with regard to treating people with substance use disorders. And it's certainly would be better to not only increase the access to treatment, but hopefully really put efforts into providing better treatment over time. We're a bit behind, the sort of typical medical world with regard to how we view it and how we see it. Legalization is a very different topic. It's say if we decide as a society to make a substance legal, that's okay. That's part of the process that we go through, but we certainly want to understand the ramifications of that and make that decision wisely. So, we have clearly made that decision with regard to alcohol, very much starting to make that decision, with cannabis and some psychedelics, and deciding what we do, as we make those decisions, we should be very, very careful. And I think there is an in between. I think that the decriminalization, of individual use is a really good idea. We shouldn't be punishing these folks, but do we want to make this widely acceptable, decrease the fear of use, think that all this is safe because it's legal? You have to be careful. And we are going to see repercussions with regard to what's happening in cannabis because with the speed that it's happening and the misinformation that's out there.
You touched on barriers. Like, what are some of the barriers that you see for people that want to get into recovery or that are trying to get sober or may not even have any idea that there's a pathway to sobriety? Like, what are some of the barriers that you have seen?
There's a barrier to getting into treatment, for one, but there's also barriers to getting sober. So a couple of barriers right off the bat. One is that someone has a substance use disorder. The symptoms of that disorder are thinking incorrectly. So denial, rationalization, minimization, lying, those things are part of the symptoms, of the actual disorder. Then you add on stigma. And stigma in itself, stigma in particular, prevents people from seeking help and wanting to get that help. So that's before you even have the help available. Then you have the problem with the availability of help and quality treatment and what's available. And there are many different types of treatment that are out there, many different types of programs. The amount of people that need treatment that actually can access it is very small, particularly residential treatment. If you think of a typical rehab, going to rehab, it's not accessible to many, many people. It's becoming more accessible now. They do have, but because of the systemic changes that have occurred. So mostly now, in that world, it's insurance traded, which is good, And when people have Medicaid, they can access treatment through Medicaid. It's really wonderful. But just being able to access their services, making sure they have insurance, and then getting them into a program has been difficult over time. I think we are making good progress, but there are plenty of barriers along the way. And then certain community and cultural beliefs around seeking treatment for mental health, and then you add on a substance use disorder. It's certain cultures, ignore that they are actually present and then don't really encourage people to seek help for it.
Yeah, that's always interesting. Like, I've always wondered if certain cultures had more of an inhibition around recovery process than others. And, like you sometimes you're in rehabs and you see an underrepresentation from certain demographics. And I've always wondered, well, is that just because they're sober or that they just don't accept that there might be an issue? You know what I mean?
Yeah. And I think there is in certain cultures, there's absolutely, a lack of recognition of a disorder and a lack of encouragement to receive treatment. But the much bigger problem is just lack of access to treatment for folks, and it really is. And it's driven by a lot of, societal factors, which we want to try to create equity in that ability for people to get treatment. But you can imagine, for example, that, you go to a treatment program that is, predominantly one race, religion, culture, whatever, and then you're trying to bring somebody in from a different culture. You have to be culturally sensitive. You have to make sure you're providing the right treatment for someone so that they feel like they're getting what they need in that location. As they're doing that is a challenge. Doing that across the board is tough.
You talked about stigma, and I think this is where your story is really so remarkable. I want to understand your your struggle, you're in medical, and you're smart, and to be and to do what you're doing, you would have had a bit of a healthy ego, I would assume, on you, and you've got this issue with drugs and alcohol. Did you struggle as a medical person to then grasp some of the nuance around things like Alcoholics Anonymous, or like the spirituality around that? Like, because I'm trying to understand, probably at a broader level, we know that the medical community and 12-step recovery and programs like that, the relationship can vary depending on the medical practitioner and the philosophy of that particular practitioner or psychiatrist, psychologist. And we'll touch on that in a moment, but I want to focus more so on your personal experience with that struggle. Like, did you feel like you could pop a pill and get sober, or like, why can't I use willpower? Like, what was your struggle as a learned person?
I struggled with all of, it was, again, I didn't have the awareness that actually what I was doing was problematic. It's crazy to think that, I'm taking pills and going to work and stuff like that, and to not recognize there's a problem there, and part of me was saying, well, okay, I'm choosing to do this. And, if I want to stop, I'll stop. It wasn't until I was told you have to stop and that this is addiction that I paused, and then, it wasn't until I had relapsed and realized the true power of this that when it really sunk in, so yeah, I had this, like you said, it was an ego in a sense of, this can't happen to me. This, no way. I know too much. I, understand this too well. Again, not about addiction, but just in general, how could this possibly happen? I work with these medications all day. I know what I'm taking. I know what I'm doing. And so, yeah, it was a true ignorance on my part about what was occurring, and the stigma was terrible. So I think the thing that made it difficult for me to get sober that first time around, it took me a few years to get sober. That's because I was so ashamed. I felt horrible. In the medical world, it's like, okay, we understand that this is, a disease or a disorder. On the other hand, we shouldn't have it. It shouldn't be a problem with us. So it is a little bit punitive. Now, the flip side of that is that it's punitive in a sense, and it's great because it's a privilege to practice medicine. Lose that privilege is incredibly shameful. I felt terrible in that. And luckily we have this tremendous support system, though, that will make us do certain things, including the monitoring, as you had mentioned, like, it's really important to know I'm going to have to pee in a cup, because that will help me to stay sober. But there was a tremendous learning curve for me. And to some degree, that stigma, which created that shame, was what prevented me from getting sober. I didn't want to tell people what was going on. I didn't want to admit to the problem, And it wasn't until I was able to let that go after struggling with it for about 4 years, really hard, and saying, okay, you know what? I really need help. I really have to do something different. I really have to change. It wasn't until I made that decision, after being beaten down, we call it the gift of desperation. It wasn't until I had that gift of desperation that, it finally got through my thick skull.
I've been told that to practice anesthesiology, sorry, I struggle to say it, it's one of the hardest things to practice, in terms it's very technical. Do you think subconsciously your choice to work in that space was driven through your addiction?
Yeah, that is actually brought up fairly frequently, and absolutely not. I don't think anybody in their right mind would choose to go into anesthesiology. And I did, during my anesthesia residency, I drank some, when I was practicing anesthesia, but I didn't use those anesthesia drugs. It was in my pain fellowship and using the pills, So there was no part of me that even thought that I would. You never considered it, not an option, no way would I do it. And I don't think anybody would go through medical school, would do a residency with the idea of, oh, now I have access to substances. There's just too much access to substances all over the place, So no, I don't think so. I can't imagine. There might have been a case or two here or there, but in general, people know. But I do think the fact that we have that access, that there is a stress associated with it, it's so easy to say, hey, can I seek relief from this? You hear so many times, oh, I just had some back pain or something. So I decided to use a little of this or that. Next thing you know, full-blown addiction. Medicines are potent. We don't have the recognition that, wow, this is, we're really going down a dangerous road if we experiment with this. It's not to be experimented with,
Yeah, I have a good friend in recovery. He was a vet, and they found him in the clinic, and he had taken some of the powerful animal tranquilizers, and he kind of lost his ability to walk. He had to relearn how to walk, and he's gone through that whole struggle of trying to get his license back as well. And yeah, it's been really, really interesting just sharing that journey with him. He's a really inspirational fellow, highly intelligent. We like to have all these kind of conversations, but focusing on that medical community and recovery, like in that landscape, we talk about 12-step recovery. We talk about different forms of, I guess, getting sober. Like, what are those forms? Like, and how does the medical community, kind of interact with that now? Like, does the medical community realize that 12-step recovery is really good? Is that the most successful form of recovery? Just looking at how medical and, I guess, the recovery space work together. Like, what are those channels for people to get sober in look like nowadays?
It is a rapidly evolving world, which is good. I think that there's much more attention paid to mental health in general, and then addictions or substance use disorders, as a subset of that, which is great. We're getting recognition, but we're also evolving our ability to treat people, whether it's at an outpatient level or a residential level or ongoing treatment. And then you add in the pieces of, the individual therapy, or seeing a psychiatrist, or your primary care physician can get involved in prescribing medications that might be good for your substance use disorder. So we're starting to kind of bring the substance use disorder treatment world into the healthcare world, which is what we really do. We want to blend that together. So it's just part of typical care. We should be screening for it. We should be, to the best of our ability, intervening as early as possible, obviously preventing it if we can, if not intervening as early as possible to have the better outcomes. So we're kind of working in that direction. And I think we're going to make great progress over the next 20 years. With regard to, and I didn't know if your question was in regard to medical professionals themselves or how the medical world is treating people.
Yeah, the medical world, as well as, from what I understand, I went into AA, and AA is the way. I guess the question is this an ever-evolving landscape where there's multiple ways to get sober now?
So there are a lot of different tools. So when we think about it, we really want to treat based on evidence, not based on what we think or what we guess or some random philosophy or something like that. We want to treat based on evidence, and that's kind of how it works in the medical world. So we have plenty of things that we know work, and they work well, like utilized was. So yeah, a very limited number of medications, and they're only used to treat alcohol use disorder and opioid use disorder. But there's a lot of evidence for the benefit of methadone and buprenorphine, or Suboxone is one of the brand names for it. Also, naltrexone, which is the opposite, sort of blocks the opioid receptor, and then with long-term injectable Vivitrol. And then there's, the older things that you heard about alcohol, things like Antabuse, and acamprosate or Campos. So there are a few medications we can use that do have good evidence, but also there is abundant evidence that shows the effectiveness on 12-step program. And some of the work now that's out there by a guy named John and Kelly, he's wonderful. He's revived this in a way to say, yes, this works. If you remain engaged in this, it is incredibly effective. But there's also, plenty of evidence to support cognitive behavioral therapy, contingency management, community treatment. So there are a variety of things that we know work well, and we want to bring them, into a program to see what will fit the needs of that individual. We want to make sure we're including the family unit in the treatment process. And then obviously there's ongoing monitoring with regard to making sure the patients stay engaged. If they're they're engaged for a longer period of time and whatever it might be, their chance to success are greater. So yeah, it's evolving, but we know we have good treatment, and we know that the treatment works.
Why do you think 12-step recovery is so successful?
I think that there are two reasons why it's so successful. One is the fellowship component and the connection that you have with other people. We talked about the spirituality, and there's no question. Yeah. People tend to shy away from spirituality. They mix it up with religion or having to believe in a deity or something. It's not that at all. When you talk about a spiritual process, it's about how are we gaining more peace of mind, contentment, satisfaction, tranquility, whatever it might be. That's the spiritual process. And when you really get connected to people and you feel a part of, and there's a belonging, it's tremendously beneficial in regard to recovery. The second piece is the 12 steps themselves are excellent psychotherapy. If you look at what we're saying in the step, and it's an infrastructure for changing the way we think and behave in order to improve our emotional state. Cognitive behavioral therapy, right? And so that's what we're trying to do through those steps. So connected to other people, when we're working a program, changing the way we think and behave in a way that's much more productive for us, taking that personal inventory, understanding who we are, understanding, of the parts of us that are our strengths and the parts that are our vulnerabilities, and utilizing that well. Doing that, it improves our relationships, it improves our, just daily functioning, it improves our quality of life. All these factors rise. But I think it's those two things. It's the connection and fellowship, and it's the psychotherapy process.
I completely agree. A couple questions on just some innovation around addiction. First question is, do you think we'd ever be able to prevent it? Like proactively know that this child or this person?
Yeah, so I think that we will probably over time have a much better way to assess someone's risk. So, for example, if we become more sophisticated, we're not there now, but at some point we can say, from a genetic standpoint, you are at, X risk compared to the population. And then we can look at those risk factors and try to minimize those risk factors and how someone is interacting with substances in that way. It's going to take some really big effort, and a cultural shift, in terms of how we talk about it, and how we raise our children, the examples that we're setting and things like that. So I don't think we're ever going to prevent it completely, but I think that we can have much better prevention. And then there's some interesting things that we'll probably see some really neat innovations, medical innovations that would be wonderful. So, for example, they've been sort of working for quite some time. There's been this idea out there about creating a vaccine for cocaine, for example. And so if you had that and you knew you were at high risk before you ever used cocaine, you would get the vaccine. So that's just an example of something that would be able to prevent the onset of a substance use disorder. And we're not going to find it for all substances. I don't know if it's even ever really possible, but I think we're going to have some great innovation that will help us be so much better at prevention efforts.
Is there a genetic marker for addiction?
There are many genes associated. It's substance use disorder in some way. And you can imagine, there are probably over 100 that have been identified now. And some might be associated with the reward from a particular substance. Because you and I both take, let's say we both take a 5 milligram oxycodone. We're going to feel it differently. Okay? You might get sick and throw up. I might think, wow, this is a performance enhancing drug and all my problems are solved, right? So, and then there's a way people experience withdrawal. There's a way people metabolize alcohol. There's a way, there are genes associated with so many different aspects of addiction or substance use disorder or substances in general that you'd have to take into consideration. And that's why we're not there yet. But I think, over time, we will hopefully get to a point where we can say, hey, you are at generally this risk. You have to be really, really careful.
How has data come into play in addiction? Like, I'll give you some context. So Charlie, mutual friend of ours, Charlie Engel, him and I were having a conversation with a guy I think that's actually out of Maryland. He's been on the show before as well, around like wearable technology, right? And monitoring people when they leave rehabs to kind of monitor spikes and potential for relapse and looking at things like that. Are things like that becoming discussed? Are there actually innovations in regards to using data to help people stay sober?
Of course. I mean, we need data to build evidence. I mean, as a general statement, what kind of data do we want is the question. In the world of substance use disorders, typically it's been self-report data, and it's been hard to follow that over a long period of time. So the long-term studies are difficult because most people are lost to follow it. Those that return to use often are not going to fill out a survey again, and many people who don't return to use aren't going to fill a survey. So there's very low number of people doing it. But yes, we want to improve data. It's a big topic right now, and a lot of places are working really hard, including us. Ashley, we're doing, we're building a strong research program. We have been for multiple years. You speak about biometric data, and wearing it right now, and we put on our patients, and so we utilize that, did that for a year. Now we're going to, redo it and put it on people for the long time, and hopefully they will watch it. Now, that's collecting data. So the idea that we're going to have a predictive model for relapse anytime soon, it's far away. Right? We don't have the ability to predict it yet, but we're going to gather data, analyze it, and see what we can do with it. And then genetic data, of course, too. And what we're trying to do is create, a data set of self-report, biometric, and genetic data. And you build a big data set, and then we see the answers that we might be able to get from that.
No, that's excellent. It's exciting space. So as we start to take the conversation to close, a couple questions, Greg, around what can family members do if they know one of their loved ones or friends are suffering from addiction, and what would your advice be to an individual that thinks they may have a problem?
So two sort of different questions. How does a family deal with somebody, a loved one, and how does that individual deal with it? And I will tell you, it's very nuanced. So I have these conversations all the time with family members, and you have to listen to the story, hear what's happening to make a recommendation about what to do. If an individual comes and says they think they have a problem, then they have a problem, And so at that point, without a doubt, seeking treatment. But I think you want to approach this and absolutely as compassionate, loving, carry all the way as you can. You're going to have a conversation with somebody, and there are different ways to intervene. There's the classical intervention like you see on the show, and that can be quite effective. And there are other ways too, where you slowly have discussions and help them to understand how this is negatively impacting them over time. But you're opening their minds to the fact that treatment is available, that even if you want to start with just an assessment, that's a good idea. Let's think about what we can do, what changes we can make. And if you're able to speak in sort of that motivational interviewing style, which is trying to have people overcome their ambivalence about by them answering the questions. So you're inquisitive, you're curious, And then at times, when someone is struggling with a substance use disorder, they know it, they've been confronted, they're pretty a lot of problems. You have to decide what your interaction with that person's going to be. So, very often it's this, like if you're headed towards recovery and you're trying to get sober, you want to, build a life of recovery, I'm with you 100%. But it's going to be really hard our relationship's going to change, if you're not able to make those changes, because it is impacting me, from a family member standpoint. A bit of a light bulb moment for me in my own treatment was before I was going to go to my second treatment. And I said, well, if I do get sober, I was talking to my dad and my wife. My dad said, well, look, you don't get sober, our relationship's going to change. Simple. I mean, the impact of that to me, he didn't have to say what it was. There's no threat, nothing. It was just a fact. You don't get sober, our relationship can change. And luckily, he was very good at the way he communicated. And my wife's communication was wonderful. She said, I can't catch you with any bait. I just don't trust you. And that statement, very impactful. So I'm seeing how this is affecting, they were able to express to me how it was affecting me in very simplistic, non-confrontational ways that it got me to say, wow, yeah, there's a real problem here.
And to that individual that may be struggling, like so many people ask me this $1 million, $1 billion question as to like how to get someone to acknowledge and admit their own issue, like get them to that gift of desperation.
And like you said, it's $1 million question. So and that's what I was talking about with regard to it's a motivational interviewing style of trying to get them over their ambiguity by asking them questions. But you do it in this non-judgmental, open and honest way. And, and you're not fighting now and they're going to be defensive. You're leaving it open. You've got to help them come to that recognition themselves rather than recognizing it. And if I like to boil into when you look at whether or not someone has a problem, I think there's one question to ask that's really, really a good question. And that is, are you continuing to use despite negative consequences? If you are a rational person that changed their behavior, because we don't like negative consequences, right? So why would you possibly be continuing to use despite these negative consequences that come up over and over and over? No. And then, that is helpful in helping someone to realize, overcome that ambivalence or whatever.
Yeah, and I think that process of an individual recognizing on their own that they're done, that's a very complex thing to unpack. And like, I don't think we actually know, I know when I got sober, I had much worse consequences my whole life from a judicial perspective. And when I decided to get sober, it was the end of the line. Something happened, but it wasn't the worst thing. And I just remember my shoulders dropping. I kind of looked in the sky, not really at a God or anything, but I just knew I was done. And it was at that moment the obsession was gone. Now, spiritual members of Alcoholics Anonymous will call that a God-driven moment. Some people might call that a cognitive process. I actually don't know. But to get someone to that moment, I don't think it can be manufactured. It's a difficult one, isn't it?
And I love hearing your story about that. Mine was in a conversation with somebody, and I was still very resistant to being fully honest and open, and I didn't have full acceptance. And in that conversation, the first step was completed. I had full acceptance. I understood I had to be honest. I understood I had to be open-minded, willing to do this. I was certainly willing to get honest at that point and accept the consequences. And after, there's a decision that was made to do it, once that decision was made and, I had full acceptance that there's real change that needed to occur and that I would be okay, my obsession was lifted. It's incredible, and it is that piece. It's really hard to understand. Why did it work then? Why not before? Thank God it didn't take longer, but you nailed it, right? I mean, it's so hard. And I wish we could get people to that quicker and better. We have some things that we try, but some people never get there.
I think that's a beautiful place to end, Greg. If people want to learn more about you and the work that you're doing at Ashley, where do they go?
Certainly, you can go to the website, which is Ashley Addiction Treatment. And we have, a phone number that we reached, which is, what is it? 410-273. In terms of searching for help, it's as easy as clicking, a little button to start the process, having conversations with people. Where can I turn? What, that. But if someone is looking for help, we're more than happy to help you, whether you end up coming to Ashley or not. We have the ability to refer you to whatever treatment to do.
Well, thank you so much for your time, Greg. I really, really value this conversation, and I know a lot of people are going to get a lot out of it. Thank you so much for your time.
Thank you, RJ. Really appreciate it.